Is your female dog not spayed? Then you need to watch this video because it might actually save her life. And I'm not kidding. Hi, I'm veterinarian Nele and I help cat and dog owners avoid sudden sickness and high medical bills without the long waiting times and stress, and so Dr. Google doesn't give you a heart attack. One of the most common natural killers for a female dog that is not spayed or sterilized is Pyometra. This means an infection of the uterus, wherein the uterus can contain pus and it hurts like hell. Pyometra or uterine infection usually occurs pretty shortly after the heat, so when they're losing the blood from the vagina. And this is because right after heat the hormones drop instantly, and this will give changes in the uterus. There are two kinds of pyometra. One is the open kind and the other one is the closed kind. The open kind usually doesn't give all that many symptoms. Your dog might not feel as good, but she will act more or less normally than before. But usually you can see stuff coming out of the vagina, like stinky, smelly, pussy stuff. Sometimes they also drink and pee more, and sometimes they are more lethargic, but that's not always the case. It really depends on if you're keeping a close eye on the behind of your dog to see if this happens. With a open pyometra, we could opt for antibiotics and anti-inflammatory drugs to fix the situation, but if the pyometra has occurred once, usually it happens after every single heat, and the next pyometra might not go so well. So we usually say have her sterilized once she is cured anyways. If at all possible, 2 months after the last heat or before a next heat. With the closed pyometra, we don't see any external signs at all, meaning nothing is coming outside of the vagina, hence the term closed, but the pus is all accumulated in the uterus and nothing is draining. So most of the time your dog is feeling very bad, lethargic. Most of the time they're drinking and peeing more, but that's not always the case. And we have to guess what the problem is. If you don't come to the diagnosis of pyometra fast enough, it might be too late and your dog might die. Not to mention that it is very painful for your dog. Pyometra might be building up very slowly. In a few weeks, you might not even notice that your dog is getting increasingly worse and that the tummy is getting bigger, is extending. Also, most of the time they have a fever, but that's not always the case, especially if it's been going on for a while. The dog might have gotten used to it and have regulated his temperature already and it became normal. Blood work can be done to find out, but usually it's quite urgent. And with a closed pyometra, medication is not the solution. We will have to remove the ovaries and the uterus, so do an emergency sterilization or spay. This week a Shih Tzu of 9 years old came in. I had never seen this dog before. This was a new client for me, so it was a very difficult case. I was thinking of a pyometra because she was not sterilized. She was presenting with pretty vague symptoms. The owner did mention that she was drinking and peeing more, which could also mean for an older dog that she has a renal problem or another urinary tract problem or diabetes and so on. The actual heat had been quite some time ago, so there was some hesitance here. I did schedule for a spay the next day because she was still walking around, seeming pretty fine. She did not have a fever, which was odd for having a pyometra. Usually they have a fever. She was not all that lethargic to me, but again, I did not know this dog before this problem. And the tummy was awkward but not super painful. The other thing was she was not eating for a few days. So they brought her in the next day and we started the operation. I do have footage about this, so if you're squeamish, I will put in chapters if you don't want to watch the whole thing, so you can skip to the end. So she had a huge pyometra filled with pus, and we were shocked and happy at the same time because I was right. The surgery went fabulously. It was a dream of a surgery. I was very happy how it went. She was very stable, breathing the whole way through, normal heart rhythms, everything normal, until we cleaned her up. So she was closed, we cleaned her up and she stopped breathing. This sometimes happens, and usually they come back after a little compression on the ribs. And we did get her heart back, and then it stopped again. She was gasping for air. We still had tube in, so she was getting oxygen. Then her heart stopped again, came back again, stopped again, and then it did not come back. I hate this kind of thing. This Fortunately, it doesn't happen often, but it is why I'm making this video, because I do not want to have this happen to your dog, and I do not want to have this happen to me again, although it will probably. In my 8 years of practice, I have not lost a dog from surgery of a pyometra. Usually it's a Hail Mary and the dog is saved and so much better, and I'm so happy afterwards, and this completely ruined my whole month. So please do me a favor and see that you have your dog spayed preventively. Ask your veterinarian when is the best time. I also have a video about this. You can take a look in the card at the end of the video. If you've had any value from this video, please give it a like so more people can get this super important information to save their dog's life. If you'd like to avoid medical or behavioral problems for your fur baby, be sure to click the subscription button below and hit that bell button so you get notified every time I release a new video. Let's keep your fur babies happy and healthy together, and I will see you in the next video.